am a nurse. Oh my goodness.
Oh,
Um, I am a nurse, and I think that's why we're all here today to talk about like my career more than anything. I have been a nurse at Sutter in Roseville for almost 10 years. Um, I have a family. I work part time, so I work 12-hour shifts, and so I work a couple days a week. Um, I don't know. I work at the Sutter Rehab Institute, which is a very specific area of Sutter Roseville. I don't know. What else would you like to know?
well, that's a great answer to that question. We can move forward because I'm going to save all the juicy details for later.
Yeah.
Let's see. Okay, so how do I go? There we go. Okay, would you describe what you do?
So, what specifically in my area of nursing that I do is we're a specialized unit of the hospital, and we take care of patients who typically need a little bit longer hospital care that maybe cannot be accomplished by the patient themselves or by their families on their own without a little bit of help and a little bit of education. Typically, what we have is we have what we call a spinal cord unit. So we have a lot of patients who maybe have spinal cord injuries or have had serious back surgeries. That affects a lot of different areas of their life. So they need some more training or rehabilitation, as you might call it, to be able to get back out into the real world and do what they're used to. We have what we call a brain injury unit. So unfortunately, sometimes people have accidents. And as part of those accidents, they end up with what we call a traumatic brain injury. And so they've hit their head really hard, maybe gotten a bad concussion, something that's caused them to where things are not just firing as they normally would. And so they need a little bit of extra help again in figuring how to get back out into the real world. And then another big part of our patient population is patients who've had a stroke. When patients suffer from what we call a stroke or a cerebral vascular accident, it can affect one side of their body to where maybe their muscles and things like that don't work like they used to. Maybe it doesn't work at all. Sometimes having a stroke affects your speech, your ability to swallow, things that you and I and Mrs. Perez, we do every day without thinking about. And suddenly one part of these patients' lives has been interrupted by some kind of an accident or medical emergency. And so we specifically kind of help to train them how to either learn to live with and work around their new disability, or how to, get back out in the public and be able to live life, and retrain their body what it's supposed to be doing.
Wow, that's really cool. Let's move on. All right, how did you get started in your career field, and what were the requirements that you had to go through to get into it? So your education, skills, all of that.
Okay. Well, interestingly enough, nursing wasn't my first choice when I got out of high school. I wanted to be an FBI agent. And so when I first went to school, I took all criminal justice classes. And, once you get into college, you kind of, as you see what classes are about and you hear stories from people like myself who or deal with that career or, do things with it, they come in and you're like, oh, wow, that might not be the good fit for me. And so when I grew up in Nevada, so when I first moved to California, just to kind of integrate myself in the community and in schools here, I took an EMT course. So that's an emergency medical technician course. And as part of my course, I had to do time on an ambulance and time in a hospital. And it was for me, the time that I did my clinical time in the emergency room, that was the light bulb, the click for me, that was like, oh, this is where I'm supposed to be. This is what I'm supposed to do with my life. So it's kind of a diverted pathway, but it was an instantaneous moment for me as I was working and doing my clinical time during that course, that I was like, this is what I want to do. And so at that time, then I kind of reshifted my focus. So I went back to college and got all of the prerequisites that you have to get before entering into a nursing program. Those are the basic English, math, science. There's specific ones for criminal justice, there was specific courses. And then for nursing, there were specific courses. So I had to go back to school and kind of catch up on some of those courses, change my route. And then once I got that done, I started applying to nursing programs. Myself, I only have a 2-year nursing degree. I haven't got my bachelor's yet, but the core nursing program is a 2-year program after you've already met all your requirements. So technically speaking, you would go to school for about 2 years to get all your core requirements out of the way before you can apply to the program. And then the nursing program at minimum is a 2-year commitment. And they start at the basics. You do different sections in mental health and in like labor and delivery and basic medical surgical nursing. And then at the end of your program, you do your clinical time. So you go into the hospital and you shadow and work with another nurse who teaches you your full last semester. The requirement used to be 144 hours, and I don't know what it is now, but you have to complete working, basically shadowing side by side with another nurse, learning hands-on for 144 hours. And then, you can graduate to take the test. So you have to graduate from the program to actually sit and take the nursing licensure test. And once you've passed that, then you can start applying for jobs. Once I was hired, now I've taken a lot of other courses through my job that are specifically related to the department that I work in. And you can always further your education. There's a lot of different opportunities in nursing to take courses that are maybe a weekend or two long, and then you'll get what you call a certificate from that gives you like a kind of an extra specialty on top of your nursing license.
Wow. Okay. So do you have an opportunity to see all of the different departments in the hospital in your like training time, and then choose like which realm sort of fits you best from there?
I guess in a way you could. When you first start, a lot of nurses start in what they call med-surg nursing, which is it's the basics, it's the nitty-gritty of nursing, and it kind of encompasses all the things that you learn in school, and you really learn how to manage patient care, manage your time, kind of be that detective, the patient advocate, to make sure that they get their needs met, because the nurse is there to work with the doctors, or kind of the liaison between the doctor and the patient. Sometimes patients forget to tell things to the doctors that the nurse, oh, did they tell you? Oh, no, they didn't. Or the nurse notices something in a lab value or on a test or something that a patient might say, and they report that to the doctor. So they're kind of the advocate for the patient, to encourage them to speak for themselves, to act on their behalf, but also they're a liaison between the physicians and the patients to make sure needs are met. As far as different units, when you do your training, you kind of, as part of the nursing program, you do some time in each department. So when you learn about mental health, you go and spend some actual clinical time in the mental health department. When you do labor and delivery, you go and do a couple rotations in labor and delivery. So that's more part of nursing school. Once you get in with your clinical nurse educator that you're going to work with on the floor when you're getting your license, you're kind of stuck in that department. However, once you get a job, a lot of times there's opportunities to float to other departments, what they call float. Hospitals are always needing extra help. And so you can say, well, I want to go work in surgical today. And if they have a shift and they want you to come, you can work there. And like I said, you can always take specialty courses on your own, or sometimes even through your work, that you can use to maybe change departments or move to a different department.
Awesome. I actually didn't know that you wanted to be an FBI agent. That's really fascinating to me. So number 4, what does your line of work entail? And can you tell us about a day in the life?
So like I kind of mentioned before, where I work, it's a very, very specific type of nursing. It's not for everybody, because for our patients, they have a little bit longer stay. So at the Rehab Institute, our patients typically stay 10 to 14 days after they're released from their normal hospital stay. But they still need acute care 24 hours a day. So for me, I work a 12-hour shift. A lot of nurses in the hospital work 8-hour shifts. There's a lot of different opportunities for different hours to work. So my shifts are daytime from 7 in the morning until 7:30 p.m. So it's kind of a long shift, but because I'm part-time, I go into work 2 days a week, and I can choose to pick up more hours if I want, but also that gives me the freedom and the time to be able to be home with my family. So typically in the morning, you kind of get there and you make sure there's medications that you give patients are all on a timed schedule. Everything's on a schedule. So that's why being a nurse, you really have to learn how to manage your time, because there's always something that has to be done by a certain time or at a certain time. So you have medication passes early in the morning. You'll have time assessing your patient. You want to do that earlier in the morning. You want to assess their skin. You want to assess their body, how they're doing. Do they seem the same as they were yesterday? Is anything different or changed? You'll look up their lab values. You'll look up any like scans or tests or x-rays they've done, and you want to kind of accumulate. In a way, you're kind of a detective in the morning. You accumulate all the information, you go to all the different spots again, so that when the doctor comes around mid-morning, if you have anything to share or anything that you noticed, anything the patient mentioned, you can pass that on, so that if more testing needs to be done or if something's missed, maybe a new medication needs to be added, it can be handled right away, and then that is going to be the best outcome for the patient. 12 hours, it gives you that ability. You spend a lot of time with your patient. So in rehab specifically, like I said, we're trying to get the patient with their new disability or their new life diagnosis, as you might say. We're trying to get them to be able to be as independent as they can when they get back home. So that means if a patient, like I said, maybe had a stroke, one side of their body's not working. Well, it's really hard because we can't automatically turn off one side of our body, but I might spend a greater part of my day just assisting that patient in the bathroom, for example, trying to teach them how to maybe get their pants up and down and be as independent as they can, so that, nobody wants to have help in the bathroom. That's, for a lot of patients, that's really embarrassing. So we a lot of time just educating them and practicing with them a new way you wouldn't think about, maybe to get your pants down and to be able to stand and take care of yourself without relying on someone else, because that's one thing as humans, naturally a lot of us don't like to give up, is our independence. So a lot of my day is spent maybe they do 3 hours of therapy a day. So we kind of follow up where therapy left off. Therapy comes and does their half an hour of therapy or their hour of therapy, but then the nurses, we kind of continue what they did and continue to practice what they learned with therapy throughout the whole entire shift.
Wow. I really love that you guys have the opportunity to kind of build that relationship with your parent or with your patients for 12 days. That's a long time.
Yeah, it is. And even the longer hours a day. So it's actually a blessing, and it's exhausting. But you really get to build a relationship with some of your patients. When I worked on the med-surg side of patients, they're the med-surg side of nursing, and that works better for some people. You acutely get them feeling better so they can just, get back home. So it's definitely a specialized type of nursing. Where med-surg nursing, you might have 6 or 7, 8 patients in a day, just because one goes home and a new one comes and then somebody else goes home. It's just, that's the more acute side of care, and this is more of a longer term thing for the patient.
Absolutely. Well, I guess that kind of answers what you like about what you do. Is there anything else, or is there anything you dislike?
Well, I will say this. I do enjoy building that relationship for the patients, and sometimes some of the most rewarding parts of the job is the fact that we do get to see that. So we get to see that change. We get to see that, for example, a patient who's had a stroke, when they first come to us, they might not be able to feed themselves. They may not be able to, because that one side of their body, from wherever, when you have a cerebrovascular accident, most of the time it means a blood clot is formed somewhere in your body and it's traveled up to your brain, and it clots off an area in the brain, and it's restricted blood flow to that message center essentially. And the cool thing about the brain is that it's really hard for them to study, and they don't know why, but your brain has the ability to reform new pathways. So once that clock goes in and it's interrupted, that blood flow and that part of the brain stops receiving messages, hence the reason why one side of your body might not work. But the brain is continuously looking for a new way to get that message to tell your body what it wants to do. So a patient may come in, for example, with a stroke, and they may not be able to feed themselves. One part of their body may not be working, but after doing continuous exercise and 3 hours of therapy a day and repracticing those skills, we're essentially reteaching their body what it was doing before, or what it's intended to be doing. And sometimes by the end of their stay, they can maybe partially move a piece of an arm or a leg that wasn't working before. We've taught them how to train themselves. So we seeing that, knowing where they come from when they first come in, and then seeing them when they go home, and that we've helped them achieve some independence and they're ready to go and they feel confident. It's that part is very, very rewarding.
Sure.
The dislike of the job is just that the fact that we do have to see people at their worst, and that's hard sometimes to see people at the very bottom. People just struggling with their new diagnosis or what's happened to them. Watching families struggle, that's hard. But then again, the reward at the end is definitely worth it.
Good. I'm glad to hear that. And yeah, I'm sure seeing their progression from, the beginning of, oh my goodness, to, the progression of, okay, you're ready to go home, and, you're ready to start the adjustment. That's probably a really rewarding thing.
Yeah.
What sort of shifts do you work? You said you work 12 hours. Do you work every day of the week?
No, I'm part-time. So part-time means you have to work at least 24 hours a week at the hospital. And so I work just 2 12-hour shifts a week. And I have what we call a set schedule. Some nurses don't. There's tons of opportunities in nursing for different hours. Like I said, a lot of nurses work 8-hour shifts. I know some nurses who work in the emergency department work like 10-hour shifts. And so there's lots of different opportunities for nurses to work different hours of the day, different times of the day, that that provides flexibility to. So a lot of our nurses I work with have 2 jobs. A lot of them, sorry, I have to turn my car on so my battery doesn't go dead. There's a lot of flexibility. A full-time nurse who works 12 hours a day work three shifts a week, and a nurse who is part-time works 2 shifts a week. Now, if you work 8-hour shifts in the hospital, working full-time is 5 shifts a week, and part-time would be 6 a week. And that varies. You might work Monday through Friday in some departments. There's so many different areas a nurse can work. You can work as a case manager, meaning you're the person who kind of organizes all the equipment and organizes the family for everything they're going to need when they go home. You can do bedside nursing. You can be a nurse in a school. So the ability to have different hours, you can really, once you get in and choose a career, you can go so many different options. You can be somebody who goes into research. There's so many things you can really kind of choose what will work best for you. But for me, it works best to work a couple days a week, and then also still have time for my family.
Right. Yeah, I think that's what a lot of nurses enjoy about that 12-hour shift. How much time do you get to take off every year? Because you're part-time, that's probably different, huh?
Well, it's not different. For at least the hospital I work at, you earn time based on how much time you work. So, so you and the longer you're at a hospital, and I think this is kind of standard, the longer you're at a hospital, the more time you earn, like 5 through 10 years, you earn this amount of time for every hour you work, you earn a percentage back towards your PTO. So for me, I basically every 2 weeks of work, which is about 48 hours of work, I earn right now about 5 hours of time off.
Okay. Awesome.
Yeah. So I don't really necessarily like a lot. I used to work in an office job, and then you get 2 weeks of vacation a year. So it probably averages out to 2 weeks. And then as you're there longer, you get more time, just like what you would with another job. It's just kind of awarded on a different way than it would be. For example, when I worked in an office, you kind of just get your 2 hours a year to use, or your 2 weeks a year to use. This one, you kind of earn your time to use it in the future.
That's really interesting, especially since you're saying that you earn, 5 hours per, shift worked or whatever it is, or per week. But you guys have 12-hour shifts, so it doesn't always pan out
Mhm.
equally, huh?
It doesn't, but it's based on the amount of time that you work. So that's
Right.
my amount based on working my 24 hours. Um, and like I said, I've been there almost 10 years. So when I actually graduate from my tenure achievement, I guess you can call it, next year, then I will actually move up into the next category of time earned. So I'll actually earn more time for my hours worked because I've been there as long as I have, for
Perfect. I love that
longevity,
they're
I
rewarding you
guess.
for longevity. That's awesome.
Mhm.
What is the most challenging thing about what you do?
Um, I get again, I think, like I mentioned, for my specific department, it is seeing people when they're at their absolute worst, or they're at their bottom, and they are just struggling with whatever life change that they've just had to go through. For me, I, I guess I'm kind of an emotional person, so I get attached to my patients. So it's really hard to see them struggle, and to see people be frustrated. I know for some nurses I work with, they struggle because the challenge is 12 hours a day and you're on your feet and it's busy. And for some nurses, it's the amount of work in that amount of time. So it's hard. You don't just sit and, there's a lot to do. There's a lot of taking the patients and making sure they have their medicine, making sure they have what they need. Um, and making sure everything gets done in a timely fashion, and it's 12 hours, so you're working the whole time. But for me personally, it is just that seeing patients when they've gone through something tragic, or they've had something tragic happen to them, and just having to kind of live through that with them, that's challenging. But on the opposite side, it's also very rewarding, again, to see the outcome, to see families come together and kind of help each other out, and
Mhm.
um, see how a family will just step in and to take care of their loved one, to get them back, to being um, out in society and being able to function like they were before, whatever accident they had to go through.
Love that. What's the most common misconception about what you do?
So, I saw this question and I actually had to look it up, because I guess I don't think about it too much, but I looked up some of the things and I can see how they would be misconceptions. And I think one thing, and I don't think about it anymore because I work in it and I see it different. But I think one misconception is, a lot of people think that to be a nurse, you have to be a woman or a girl. Um, it's everywhere I looked, every website, I was like, God, what do people think about, nursing? Is that they think most nurses that you need to be a woman. And I work with tons of men that are nurses in my department. Um, I think that's kind of a stigma that maybe was placed on nurses back clear from Florence Nightingale, right? That the men were the doctors and the women were the nurses. And it's not like that at all. I work with a ton of male nurses and female nurses. So I think that's one of the common misconceptions. What was the other one I saw? Another misconception is, that nurses like work crazy hours. I saw that one. Well, you can kind of choose what kind of hours that you work. Like I said, depending on what area you want to go into. And one of the best things to do would be, if you chose that as a career and you got your license, and you reach out to nursing recruiters at hospitals, try to shadow nurses that work in a field that you think you might be interested in. I know I was like, oh, I want to be a labor and delivery nurse. But when I did my time with the labor and delivery nurses, I was like, yeah, this is not for me. Right. So sometimes putting boots on the ground and just like seeing if you can get a shadowing shift. It's hard right now with COVID. to get that volunteer time, but to see if you can get that shift, in different parts of the hospital, to really see what would fit you the best, because there's so many avenues. So the crazy hours are kind of, if you work crazy hours, it's hours most nurses have chosen to work because they're choosing to stay in the department that they're in because they enjoy it.
Right.
Now those are like two of the biggest ones.
Okay. So what advice do you have for anyone looking to get into your career?
Well, the one thing I can say, and especially speaking for myself, is, it's never too late to choose that for a career. Like I said, I really wanted to be an FBI agent when I left college, and I went and graduated with an associate's degree in criminal justice from school. So I went through that entire, process of working towards, and started working on my psychology degree. And by the time I graduated from nursing school, I'm going to age myself here. So I was 31 years old. So I was a little bit later in life, before I started my career. And for some people, they know right out of high school what they want to do. And for others, you think you know what you want to do, and then you see, or you get a dabble in that and you go, oh, this isn't for me. And it's okay to change your mind. It's okay to be older and figure out what works for you and what works for your family. Sometimes that's what might change it for you. But like, well, when I was 18 and young and free, this is what I wanted to do. And now I'm an adult and I see the world differently. It's okay. It's okay to get a later start. It's okay. I worked in different fields while I put myself through school to get my nursing license. And that's okay. You don't always have to know what you want to do right when you leave high school. It's okay to try different things out until you figure it out. And at least for me, by doing that, it led me ultimately to a career that I really enjoy.
Awesome. Yeah, that's such good advice, especially for these kids to hear, because they're exploring different careers at this point, right? Like we're trying to provide them opportunities to explore those avenues now, so that they're not dropping a ton of money in college or down the road or anything else.
Mhm.
But yeah, that what, there's something to be said for life experience as well. And yeah, I love that. Well said. At this point,
And
oh, sorry, go ahead.
oh no, I was just going to add to that, that especially if it's specifically for nursing, that because you can go to like a 2-year college, you can go to, get to any junior college, and once you get in the program, get your nursing degree. Remember that you can always go back to school, so you can start working in your field. And my intention is, once my kids don't need me 24 hours a day and I don't have to be the mom taxi, that I will go back to and further my education for myself. And so it's, that you can get a start in your career and start, working towards your goals. But during that process, you can continue your education indefinitely in life. And there's always new stuff to learn. There's always new skills to acquire. There's always opportunities for growth and
I love
change.
that. Lifelong learners. Yes. At this point, I'd like to just go ahead and ask the audience if they have any specific questions that they would like to ask you. So you guys, I'm going to turn the floor over to you. And if we don't have any specific questions, that's okay too. But if we have some come in later, Heather, I will definitely let you know. And we'll wait a couple more seconds for people to just ask questions.
Okay, I thought I saw something flash up at the bottom of my screen, but I couldn't click on it. So did you say something? Can you see questions? Are they typed?
Oh, yes,
Reese?
they are. So Mary, who is one of our counselors, said, thank you for talking about never too late. My daughter is 29 and was just accepted into nursing school. We are thrilled that she took her time to land on what she's passionate about. And the other audience comment in here, it's a question. It says, you say that after 2 years, you go to an additional 2. Is that for an LVN?
No, that was actually to get your RN. You can do an LVN program. So there's so many different avenues available, and especially in our area, there's several junior colleges around here who, offer different levels of nursing. And I know a lot of people I worked with, a lot of the nursing programs, it's what a lot of people start out wanting to do. So the nursing programs can be hard to get into. And so some nurses do choose to take the avenue to go to school to get their LVN, which is a licensed vocational nurse, and then they offer like a step up program from that. So then you can apply to go in, and then you step up from being an LVN to an RN. So it's a shortened. You join the last 2 semesters of the RN program. So for some people, that's a better path because they want to get working sooner than later. But yes, what I did say was, to get into a nursing program, it's about 2 years of schooling, 1.5 to 2 years, depending on how motivated you are, of classes that you have to take, what they call prerequisites. And those include the basics, the Englishes, the maths, some extracurricular classes, and then a lot of sciences. There's a lot of science and chemistry, biology that you have to take, required courses. And then you apply for the nursing program, and that is at minimum a 2-year course, and you would end up with your registered nursing license. I just don't have my BSN in nursing. I have an associate's degree in nursing, but I plan to get my bachelor's in the future. There's a lot of options too now. Once you get your nursing license and you're able to sit for your exam, that you can do a lot of courses online now. So for my bachelor's, I would be able to complete most of my program online. So in my time at home while around working and around my kids' schedule. So
What does having your bachelor's degree, how does that benefit you? Because I know you're already a nurse. So how does that change things?
So, anytime you have more education, right, you're going to be able to serve your patients better. The more education that you have, the more exposure you get to new things. You'll always it'll help your higher level of thinking, right? And might be exposed to something in a course that you're like, oh, wait, I dealt with this. And then kind of go back. For me, if I have a patient who has a specific diagnosis, I might not know a lot about that, but the next time I have a patient with that diagnosis, just from being exposed to it in the treatments, it's going to kind of ping things in your mind like, oh, wait, I remember, this patient that we had last time benefited from this. And that's the nurse's job, is to speak to the doctor and say, hey, doc, I noticed they're missing this, or they haven't been tested for this. So anytime you can expose yourself to more education, you're going to possibly come across something that you might remember and you might be able to save in your brain that might help a patient that you're actually taking care of in the future. So, it's necessarily, I work with a nurse practitioner who works on bedside nursing on the floor with me. I work with nurses who have bachelors, and I work with nurses who have associate's degree. I have heard now that a lot of hospitals now are wanting nurses to have their bachelor's degree. Fortunately, 10 years ago, that wasn't, the case. But I have heard that a lot of hospitals are preferring to have nurses with a bachelor's degree. But again, that's something you can work on once you already have a license. So as far as differences, when you have a bachelor, I think to be a school nurse in a school, you have to have your bachelor's degree, because they take a specific section of their program and do public health. And so that's not something that you get in your regular nursing program. So if you wanted to be like a school nurse, I'm almost positive that you have to have your bachelor's degree. So there are some avenues of nursing that require a bachelor's, and then there are some that don't.
Awesome. Okay. Well, Heather, I just want to thank you for your time. And I just want to thank you for sitting down with us and giving us all of your wealth of knowledge. And and I just want to, I appreciate it. I totally appreciate your time. I know how valuable it is. And we just want to thank you so much for being the very first episode of Career Conversation.
Oh, that's a lot of pressure.
You did wonderfully.
I apologize. I apologize for signing in late. Technology is definitely not what I went to school for. So it kind of escapes me. So I apologize to everybody for being late because that was definitely not the precedence that I wanted to show to everyone. So thank you for being patient with me and waiting for me to figure out how to log in.
Oh, all right. Well, Heather, take care. And thanks again so much for your time. And
All right, thank you, everyone. Have a good day.
all right, you too.
Okay, bye, Mrs. Perez.
Goodbye.